Start recording the webinar. Okay. Good afternoon, everyone. Thank you for joining me on today's webinar. It's 12:15 p.m. And I'm going to start my webinar. My name is Sunny Sharan, and I'll be the host for today's session on understanding macro MIPS. The objective for today's webinar is what do you need to do today to position yourself for maximum incentives under the MIPS program. So I'll focus primarily on the quality performance category. A brief introduction about E2O Health. We're an innovative healthcare IT solutions company, and we specialize in providing compliance services around meaningful use, HIPAA, and quality improvement programs, PQRS, HERES, MIPS, MIPS, and MACRA. So that's what we do. We simplify compliance for ambulatory medical groups. Why do we do our webinars? This is why we do our webinars. We hear a lot of frustration from provider organizations. Hey, this is so confusing. A lot of compliance initiatives are being thrown at us. How do we make sure we meet them successfully and don't get penalized? So with the help of our webinars, we want to simplify the compliance, make it easier for you to comply with these mandates while you're providing great care to your patients. We want to provide a whole lot of education to our participants on MACRA, MIPS, and APMs, and ensure that all of you who attend our webinars are well positioned on all of these compliance requirements. Here's how the structure of our webinars. It happens bi-weekly between 12:15 p.m. and 1 p.m. It'll be a 45-minute webinar. It won't be more than that. I'll try to end it at 1 p.m. unless there are questions. It'll cross 1 p.m. Otherwise, the content is structured for a half an hour presentation and a 15-minute Q&A. So it should end by 1 p.m. every week. It's bi-weekly. The next webinar is on the 22nd of February. The whole objective is to make sure attendees comply, attendees learn a whole lot about MIPS. So there will be a lot of interaction. I'll have questions I'll be asking along the way to make sure that you're following. And also, you're thinking as we're making progress. And you can also ask questions while I'm presenting by typing into the chat window or clicking on the hand icon on the GoToMeeting screen. I will take questions as they come up. So I won't hold. As soon as I see them, I will take those questions. So feel free to ask questions. So I highly encourage participants. And also, if any one of you wants to share something that you learned that's beneficial for the other participants, please raise your hand or post it in the chat section. I will unmute you and you can discuss that. So I'll encourage participation through these webinars. The objectives for today is I'm going to review what we've covered on the MIPS program in general. What is MIPS about? What is MACRA about? I'll do that overview because I do have new attendees every webinar. So I'll take like 5 minutes to talk about what we covered in the past webinars. And then focus on what you need to do today to position your organization or yourself if you're a solo provider for maximum incentives under the MIPS program. So that's the focus. And I'll primarily talk about quality performance category, and I'll leave with 3 action items. So they'll be at the end of this webinar. If you have to remember, I just want you to remember 3 action items, and I'll talk about them at the end. So you leave this webinar with 3 action items on MIPS, what you need to do to make sure you're positioned for maximum incentives. Because MIPS is still new, anybody who's attended these webinars and learning about this, you're ahead of the game. So it's good. So if you're frustrated or stressed out, please, I would encourage you that you're in a good place. You're in a good position to start off to get maximum incentives. And the reason I use frustration is because I see that when I talk to providers, I hear that frustration, so that's why I'm trying to address. I'm talking to those frustrations. If you're feeling overwhelmed with these initiatives, it's you're in a good place. You're early, and you should be in a good place to comply and do well under MIPS performance. MIPS. Okay, so review of MACRA. MACRA is Medicare and CHIP Reauthorization Act of 2015. It changes how Medicare pays providers, and these changes create what's called a QPP. I want you to remember this acronym QPP, Quality Payment Program. You'll see this in your Medicare communications. If Medicare sends a letter, you'll see a word called QPP. So remember that. So this MACRA creates a quality payment program, and it is a framework for rewarding for better care and not just more for care. And it combines several of the quality reporting programs that providers are complying with into one new system. And those are, it combines PQRS, it combines meaningful use, and it also combines value-based modifier and adds another program, and it calls it as MACRA, or there are different paths to it. It's under one umbrella now. So just to remember, MACRA is a step towards value-based care. There are two paths in MACRA, meaning you can participate in MACRA through merit-based incentive payment system, MIPS, which is applicable to eligible clinicians servicing Medicare beneficiaries. It's not applicable to hospitals. Why? Because hospitals do Medicare Part A billing. So MIPS is applicable to clinicians. Anybody who bills Medicare Part B, MIPS is applicable. If you bill Medicare Part A, then it is not applicable. So MIPS is primarily applicable to hospitals, is not applicable to hospitals or facilities. Or if you're a QHC, however, you have clinicians billing Part B, then it is applicable. So if you bill Medicare Part B, Medicare MIPS is applicable to you. Then the other path to comply or to participate in the MACRA is through what's called, it's a new acronym, remember this acronym, APM, Advanced Alternative Payment Model. What it means is it's a payment model which is based on risk and reward. I will cover this later in other sessions, but just remember for this session, an APM is an Advanced Alternative Payment Model. It is another pathway to participate in the MACRA program. If you are part of an ACO, a Medicare Shared Saving ACO, ACO stands for Accountable Care Organizations. If you're part of an Accountable Care Organization, either Medicare Shared Savings Program or NextGen ACO, it's applicable to that ACO. Okay, or if you're also participating in a patient-centered medical home model, it is a home model. It's a patient-centered medical home model. It's applicable in some states. I don't think it's valid in California. So if you're in California and I don't think this patient-centered medical home model, it doesn't exist as far as I know. I may be wrong. So that's one way of participating in the APM. Also, if you're participating in the bundled payment model with Medicare, you may also be participating in an advanced alternative payment model. For now, for this slide, just remember there are two pathways. Either you participate through MIPS or you participate through APM, one or the other. If you participate in APM, you do not have to report on MIPS. If you report on MIPS, you don't have to, if you can also report on MIPS if you're in an APM, but if you're in an APM, you don't have to report on MIPS. Okay, I'll focus on merit-based incentive payment system, but before I do have a few questions I want to ask you, so I make sure I'm making sense. Let me ask you this question. Based on what I told about MIPS and APM, have you thought about which macro path will you be participating in? So I have a question on your screens. The question is, which macro path will you be participating in? I have around 11 participants. Let's see how many, it just doesn't tell me how many of you responded, but I have 56% say MIPS is applicable to them, 44% says I do not know, and 0% says APM. Okay, so let me just share the results. Here's how it looks like. 56% says MIPS, 0% says APM. The reason that's very valid. So many of you are clear that MIPS is applicable to them. Many of you, APM, nobody knows about it yet, and a lot of people are not sure whether they have to participate through MIPS or APM. So let me pause here for a minute and talk about one thing. It's very important for you to determine whether you have to participate in MIPS or APM. So I have a follow-up question for you. The follow-up question is, are you currently participating in an accountable care organization? So are you currently participating in an accountable care organization? Okay. I have 60%, 70% votes in, 75%. I have, 2 or 3 more people did not vote. If you can vote, I'd really appreciate it. So I want to see, if it makes sense. I'll wait for 5 more seconds. If you haven't voted, please do, so it'll help me get a better sense. Okay. So here's what it is. 33%, I have only 11 participants. 33 or, percent of you say, yes, you currently participate in an ACO, and most of you say no, and several of you say, so that's what it is. So if you participate, the reason I ask this question is this: if you participate in an accountable care organization today, your action item would be to call them and find out if they will be an advanced alternative payment model, if they will be an APM. So that's one thing I want you to find out. If you're currently participating in an accountable care organization, reach out to them and find out if they will be an advanced alternative payment model or an alternative payment model. Okay, it's important for you to understand that. So that's one thing. If you're currently not in ACO, then you're 100% sure then it's MIPS. You have to report on MIPS. So if you're not part of an ACO or never been part of an ACO, then you have to participate in MIPS. Now, there's one more thing. How do there's one thing I just want to quickly talk about is several of you say, hey, how do I find out if I'm in an ACO or not? Here's something I'll tell you. So just Google Medicare and physician compare. This is something I want to start talking to providers a whole lot. So you can find out several providers don't even know that they're part of an ACO. And this is how you can find out if you're part of an ACO. Go to this website, medicare.gov/physician compare, and search. I'll search for a provider I know who participates in an ACO. The doctor's name is Steven Solson. He's in Torrance. If you look up this provider, Medicare lists this: reported performance information as part of an accountable care organization. If you have this, that means you're participating in an accountable care organization. It's just that you just have to find out who, what they've been doing on your behalf. So the reason I want to kind of throw your attention to this is because Medicare will start displaying your performance scores on this website, medicare.gov/physician-compare. If you look at this, you can track how a particular provider is doing on various measures. Okay, this is public information. It also displays you're using electronic health records and what other performance programs are. So I'll quickly recommend that you take some time to go over that website. It's called medicare.gov/physician-compare. Okay, now coming back on to MIPS. So I want to pause here for a minute to make sure how are you doing? Does anybody have any questions? I'll appreciate if you can share some info, some feedback. So far so good, or did I lose anybody? Okay. So I'm going to talk about the path that we're going to talk. See, I see some feedback. I want to make sure we're good. Okay, thanks, Kelly. Merit-based incentive payment system. According to this path in MACRA, it streamlines 3 programs to work as one, and the whole objective is to ease clinician burden. So it combines meaningful use, PQRS, and value-based modifier program. And it adds a 4th component called improvement activities. So you have quality, which is the current PQRS program, and then resource use, which is the value modifier program. This is the new performance category called improvement activities and meaningful use. Also remember, when I refer to advanced care initiative, or the meaningful use under MACRA is only the Medicare meaningful use program. If you are participating in the Medicaid or Medi-Cal meaningful use program, you have to still participate in that meaningful use program. The state-based, the Medi-Cal in California or the Medicaid in other states, the state-based meaningful use program still exists, so that's not going to be replaced. However, if you participate in the Medicare EHR program, that will be replaced. You don't have to report it any longer, and you can do it through MIPS, the merit-based incentive program. So a few things to learn about MIPS is I want to talk about who's eligible, what are the scoring, what's the scoring look like, and data submission, and the period and the adjustments. So let me look at eligibility. Whom does it affect? Any clinicians and facilities serving Medicare beneficiaries. If you're a clinician who see more than 100 beneficiaries or bill more than 30,000 in Medicare Part B charges, it is applicable to you. If you're a clinician or a group that see more than 100 beneficiaries and bill Medicare Part B more than $30,000 in charges, then MIPS, you have to report on MIPS. Otherwise, there will be a penalty. So you have 2 options. You can report as an individual or you can report as a group. So let's talk about scenarios when you'll choose individual or group. You can actually, if you overall as a practice, you see more than 100 and 30,000 in Medicare, but your individual providers does not see more than 100 and bill more than 30,000, then it's better to report as an individual and claim an exclusion, because the individual clinicians are not seeing more than 100 patients and 30,000. But if all of your providers are seeing more than 100 patients or bill 30,000 or more in Medicare, then it's better to report on as a group, because it's a lot more convenient. It reduces a certain amount of reporting burden. So you can report as a group if you are 100% sure you have to, all your providers see more than 100 patients or more than 30,000 or bill more than $30,000 in Medicare Part B. Okay. I have a question for you. The question is, Do you meet the minimum threshold to participate in MIPS? Okay. So looks like everybody on this webinar meets the minimum threshold of 100 patients or below over $30,000 in Medicare. Okay, good. So it means you have to report MIPS, and that's why you're here, I assume. Okay. So let's understand a little bit on MIPS performance scoring. I will only focus on one performance category. So as I talked earlier, MIPS is 4 performance categories, and your scores on the 4 performance categories will be weighted to compile what's called a MIPS composite performance score. And based on how you do here, you will either get incentives or penalties. So here's I'll just talk about this slide. In year 1, that is in 2017, you have 60% weight for quality, which is the PQRS. Your PQRS or the previous PQRS program, or the reporting of the measures, or the quality performance category, will contain 60% of the weightage, 0% for the resource use, 25% for meaningful use or the advancing care information, that's using an EHR, and 15% for clinical practice improvement activities. So a high weight is assigned to quality in 2017. So we will focus on this whole month. In this webinar and the next webinar, we'll talk about quality performance category. Okay, so what do you need to do in order to get that highest score in quality? You have to select 6 measures to report on. One of them has to be an outcome measure, or another one has to be high priority measure if outcome is not measured, if you don't have an appropriate outcome measure. And you may ask me what's an outcome measure and all of that. I'll just show you that in a brief demo. So I'll do a demo of how to choose these measures in just a minute. Okay, so and then you can select from individual or specialty set. So I'll show a demo, so hang on to that. And the key changes from PQRS had 9 measures to report on. They've kind of made it 6 measures. And the emphasis is on outcome measurement, and year 1 weight is 60%. Okay, here are the action items. So if you leave this webinar, I want you to just go with these 3 action items. Identify your MIPS submission method. So you need to understand how will you be submitting, or how will you be reporting your MIPS data. Second, identify 6 measures that you will be reporting on from qpp.cms.gov, and I'll do the demo in just a minute. So step 1, identify your MIPS submission method. Step 2, identify the 6 measures you'll be reporting on from qpp.cms.gov. And step 3, once you identify the measures, you choose, please start tracking them regularly. And this is something that you need to go back and do a whole lot. This is an ongoing. Step 3 is the ongoing value-based care thing. That is what your providers have to do and all of that good stuff. So I'll talk about that also in that slide. So there are 3 action items I want you to leave with. One is identify your MIPS submission method, identify the 6 measures that you'll be reporting on from qpp.cms.gov, and then start tracking them regularly. Now, in order to identify your submission method, you need to know how you currently submit your PQRS information. So let me ask you a question. How do you currently submit your PQRS information? So let me ask you this question. Okay. So here's what it is. As you can see, out of a subset of 11 participants, I see claims, I see EHR, I see accountable care organizations, and we do not submit PQRS. So as you can see, so everybody submits it through different ways. So I want to talk about this. So understanding this is very important because you'll probably be sticking to the same way, or maybe you'll change your way of submission. So we'll come to this question. So there are different ways of submitting PQRS. I'll talk about this in just a minute. I also have another question. This is just, I want you to make sure that you remember this date. Okay, this is just a do you know question. Do you know when you have to submit your PQRS data or MIPS data to CMS? When will you be submitting your MIPS data to CMS? When will you be submitting your MIPS data to CMS? Okay. Okay. Here are the results. The answer is the deadline, the final deadline will be 2018, before March 31st of 2018. So this is very important because you are reporting now, and I'll talk about this in the following slides, but I'll explain why. You track it in 2017 and report it before March 31st of 2018. So there won't be any reporting done now unless you're doing it through claims. That's why I have an answer here every day through claims. Okay, and I'll talk about this in my following slide. Okay, so step one, action step one that I want you to make sure you do it is you identify how you currently submit your PQRS information. If you do it through claims, you're currently submitting your PQRS through claims. How do you do it through claims? There is a way to include a G code in the claims. In every claim you send, if you include the G code, then you're saying that you performed, so and so quality measure. Okay, if you include the G code, submitting it through that currently for PQRS, you can also do a similar thing for MIPS. So you can report to MIPS using a particular code. We're still not sure what the codes are, but you could still continue to report on using the G code through the claims, which is an ongoing process. You should be doing it by now. So if you're reporting on this, you'll automatically meet the MIPS quality performance category. That's one way of doing it. If you haven't done in the past, I would recommend not to do it because there are other ways of doing it. EHR. Several of you mentioned that you're submitting your PQRS through EHR. What does that mean? You open a ticket with your EHR and your EHR vendor will do it either for free or they'll charge a particular fee. It varies from vendor to vendor. You can also do the same thing with MIPS submissions going forward. Many EHRs will be certified to submit that. So you'll probably have that option. So you have to determine which way is better for you. So the second option that's available for you is through EHR. Then there's the qualified registry. So if you're using any qualified registries, there are several of them out there. Even E2O Health is one. If you work through any qualified registry, they will you just have to export files or use their website to document, or send your files to them and they will upload it and they will submit it to CMS. So the qualified registry option is one. And then if you're part of an ACO, some of you said, I do not currently submit PQRS. The reason you don't submit it there are only three reasons why you don't submit it. One is you didn't know and you didn't submit it and you're getting penalty letters. Or one is you didn't know that your ACO is submitting and you never have to worry about that because you're not getting the penalty letters. Or third is PQRS doesn't apply to you. And except otherwise those three scenarios, you have to submit PQRS, and so you'll be submitting MIPS. Um, just to let you know, if you are currently in an ACO, I would recommend that you reach out to your ACO to see if they will be an APM and they will be submitting your MIPS quality data to CMS. Because if you know that they'll be doing it, or if you'll have some arrangement of doing it, then that's one less thing to worry about. So you don't have to worry about that, and that's you could take off that uh, that space to worry about something else. So check with your ACO. So action item 1 for you is identify your submission method. Okay, claims EHR qualified registry APM, and there may be another option through reporting directly to CMS, which nobody knows yet, but these are the 4 options that you have to submit your MIPS data. Okay, and the deadline for that is March 31st of 2018. Okay, the deadline is March 31st, 2018. Okay, so I have a question. Let me just take that question. Deborah, we did claims all of 2016, and we are being told that we did not meet the requirements even though we received correct notices of EOBs from Medicare. Now, the question, let me read that question aloud. Deborah's practice submitted PQRS through the claims and are being told that they did not meet requirements even though we did the correct notices on EOBs from Medicare. Now, there are based on my knowledge of that, there are 2 things that might have happened. One is they might have sent that letter by mistake, for which you can actually appeal for that letter. Oh, you know what? Actually, let me tell you one thing. Okay. So I think I want to ask you a question. Did you get a letter, or did Medicare tell you that you failed 2016 or you failed 2015? Deborah, can you answer that question for me? Did you get a letter from Medicare about 2016 or 2015? Okay. And did you do all the claims in 2015 or 2016? Or did you do both? Did you submit PQR both? Okay, you did both 2015 and 16, but you're told that in 2015 you failed. Okay, so that's then there are 2 things that might have happened. One is CMS might have sent that letter by error, and I've seen those letters sent by error. It happened last year, so you can appeal it, and they might consider it. Second thing is, which I'm not 100% sure, but I might need some. I'd be happy to take a look if you reach out to me on the side. I'd be happy to take a look as to what happened there. And what I believe happened is, you probably did not use the right G codes, but you're saying that you received notices. So reach out to me on the side. I'd love to help you out and also use the opportunity to learn. So I'm not sure what happened, but the letters might have been sent by accident. That's one thing. The second scenario is you probably did not use the right G codes, or you probably did not use the G codes for measures that are not PQRS measures. So let me ask you one question. Did you use the proper G codes for the right PQRS measures, or you just randomly picked some measures and did that? Deborah, did you when you started using those G codes, did you select the right event by the PQRS codes? Okay. So you know what, I don't have a right answer, but I'd love to help you out. So please reach out to me, or I'll reach out to you, and I'd love to help you out. Okay, so if you do the claims, you should be doing it now. But why? Let me also answer Deborah. I do also have one provider on this line who's actually done it through claims, and she was not dinged. So claims works, if you got an error, either it's by, if you got a letter saying that you failed, that means there's a mistake, or there's some, you haven't done it appropriately. Also, also I want to use the opportunity to report by claims. It becomes very, you've done the whole work, but then you did not meet the requirement, so it becomes a little. That's why claims is the least preferred way. I don't want to demotivate you if you're already doing claims, but claims is the least preferred way as far as what I've heard on in the various other vendors talking about it. So claims apparently is the least preferred way. But Deborah, I'd love to help you out. So step one is select your submission method. Step two, now moving on to step two, is select your 6 measures. Now I want to show you how you could select your 6 measures. Let me ask you one thing. Has anyone done the homework from last week? So I just want to ask this question. Last week, 2 weeks ago, when Kelly did her webinar, she sent a list of Excel file with a list of all the CQM measures. And she recommended that you select those measures. I want to see how many of you took action on that. I'll just wait for 5 more seconds. Here's what it is. So some of you have taken action. Some of you said, how do I do it? Please explain it again. No, I did not attend prior week's session. So, okay. So how do you go about selecting those measures? So I'll kind of quickly demonstrate how to do it. First, go to this website. There are 2 different ways of doing it. One, the best way is to go to this website, qpp.cms.gov. I talked about it. QPP stands for Quality Payment Program. Go to this website. Click on Explore Measures. This is a very good website from CMS, so you should go to this website, qpp.cms.gov, and then click on Explore Measures and select Quality Measures. Okay, and then you select your, let's say I want to submit it through EHR. I select my specialty, and then it'll give me the measures I can choose from. You have to select 6. So I select 4, and then I can select 2 more. Let's say because I don't have all 6, I only have 4. I select certain other measures. Something that's kind of generic, but I still have to do it. Okay, so I select my 6 measures. Now, not all specialties have 6 measures, so you can select those measures and download the CSV. So it gives you an option, so it'll give you what measures they are, and then you can go back and work with your EHR on tracking these measures. Okay, so the way you select the measures is go to this website, qpp.cms.gov, click on Explore Measures, go to Quality Measures, and then type in your specialty, and you'll get the measures. You can add the measures and download the measures so you can start. So that's one way of doing it. The other way is the other way of doing it is we sent you a list of all the measures in an Excel file. I'll send it again, and then you can actually sort them by specialty and track them. So you can select, let's say, you can select by specialty, and then you can do that, and then you can select which measures you want to track. So again, I would highly recommend go to this website, qpp.cms, where you can track those measures. The other way is to use the Excel file that Kelly and I will send. Kelly send and I send, so you could choose your measures. That's step 2. Step 3 is start tracking your measures, and this step is varies from practice to practice, from measure to measure. Also, where your providers are and your supporting staff are with will have to participate on this process. So it varies from practice to practice. The way you can incorporate tracking the 6 measures into your daily practice here, one is have a monthly meeting with your clinical staff to evaluate the quality measures. Then send reports on a regular basis to your providers on how they are doing on their 6 measures, and then identify improvements and better workflows to improve these scores. So having an ongoing uh, meetings and discussions about improving care, this is the crux of the whole thing, value-based care. So you not only have to, once you identify, then you have to start implementing the workflows and processes to track them. So this step 3 varies from practice to practice, size of the practice, and EHR to EHR. So my next week, our next webinar will be around how, taking a sample scenario and discussing how you can implement better workflows to start tracking these measures. Okay, those are my action items. Again, data submission, you can submit through different ways. So I want to talk about performance periods and timelines. I asked you a question. You'll be reporting for 2017 in 2018. Also remember, you can request a feedback report in July. So if you can do a sample testing and then request a feedback report in July. We'll guide you on that when all of that will be available. And then the penalties for 2017 or the incentives will be given in 2019. So if you do really well, you'll get incentivized. I think all of us here will get incentivized, and excuse me, our objective is to make sure that you get the maximum incentive, and we want you to get that in 2019. Okay, with that, I want to talk about the 3 things we did, and not 4 things. Sorry about that. 3 things. Identify your submission method. By next week, I want all of you to know which submission method you'll be doing, what are the 6 quality measures, and how to start tracking them. With that, I want to remind you of 4 terms: MACRA, Medicare and CHIP Reauthorization Act; QPP, Quality Payment Program. Remember this, the website is qpp.cms.gov. MIPS, Merit-Based Incentive Payment System. APM, Advanced Alternative Payment Model. Just remember that, because if you hear these acronyms by now, you should be very familiar. Okay. Sorry about that. Okay. Any questions before I conclude? Have any questions? Let me know. And the plan for my next week webinar is to review a sample scenario of how a practice started to track their quality performance category. So I would like to ask you if any of you would like to volunteer next week. I'd like to work with you between now and 2 weeks and start helping you set up those 6 measures and track that. And then I'd like to discuss your situation as a case study. So if there's any volunteer, I'd like to help you out the next 2 weeks and then use that as a case study, and you can present it along with me. So if you, I'll follow up to see if any of you is interested, but that would be my next week. So discuss how to track performance, how to track performance categories, quality performance category. Okay, I have a question while I also see a hand raised. So did you learn anything new information from today's webinar? Well, that's feedback for me, so I'd like to know how that works. Jordan, I see that you raised a hand. Should I unmute you? Let me unmute you. Let's see if you have a question. Okay, Jordan, I unmuted you. Did you have a question? Speak up, Jordan. Hello? Jordan, did you have? Okay. Paulette, did you have a question? Paulette? Excuse me. Okay, so then I have one more question, which is that do you know if your EHR reports MIPS data or will report MIPS data? Have you asked your EHR vendor? Okay, so several of you don't know whether your EHR reports it or not. That means that basically nobody has, nobody should be report. I mean, should say that they can report. They are reporting. Most EHRs will be reporting in future, but that process has not yet been finalized. CMS will announce that in a few weeks. So most EHRs should be able to, but watch out for that. Okay, there's another question. Is eligible clinicians include physician assistant or nurse practitioner? Yes. Eligible clinicians include physician assistants and nurse practitioners. If they're billing Medicare Part B, yes. But I assume in let me answer that let me make sure. Yes, the answer is yes. Even they're also qualified when you're again. The reason I'm pausing is the question depends on how are you billing their claims. I know for Medicare you have a supervising provider and all of that good stuff. So are you billing on whose NPI? So that is the answer. If you include the physician assistant or the nurse practitioner's NPI, then I assume yes. The answer is yes. You have to report. MIPS requires eligible clinicians include physician assistant, nurse practitioners. Okay. Any more questions? I'll be here for a few more minutes. Otherwise, thank you for attending my webinar. I'll see you on 22nd of February with a sample scenario of how to go about tracking clinical quality performance category. Thank you for joining.